So let's look in detail and review each of those 5 toothpastes that we mentioned at the beginning. So number one, let's look at Sensodyne Repair and Protect. This toothpaste has not been on the market for that long, and it was actually a direct response to the toothpaste that came out by Colgate called Pro Relief, which aims to reduce sensitivity almost instantly when placed on a sensitive tooth. So let's get one thing cleared out first, and that is that in reality there is no toothpaste which can just get rid of your sensitivity just by applying it neat onto a tooth. It sounds too good to be true, and when things sound too good to be true, they usually are. However, it tends to have claims that it's better than the normal regular Sensodyne toothpaste. The regular Sensodyne toothpaste is probably the toothpaste that's been around for longer than any other sensitive toothpaste. So Sensodyne Repair and Protect, it costs £5 from Superdrug, so it's quite expensive for a 75ml tube. You can go into the pound shop and get a tube twice the size for £1, so it can work out costly if you're going to use it every day. It's got a nice consistency to it. You want to be using a sensitive toothpaste which is quite viscous, so that you can place it directly onto a tooth and it can continue working on there even after you've finished brushing your teeth. The best way to use all of these sensitive type of toothpastes are to use it at night as the last thing, and not to rinse your mouth out with water afterwards, so that a thin layer is always on the surface of the teeth working away. So what's in Sensodyne Repair and Protect? It contains sodium fluoride, which we spoke about. It also contains potassium nitrate, and then it contains this new kid on the block called Novamin. Novamin is supposed to act to remineralize the minerals which have been lost on the surface of a tooth, hence these lost minerals protect the tooth. In reality, Sensodyne Repair and Protect works quite well, and probably works better than the regular Sensodyne toothpaste. It is really formulated for people who have more than just mild sensitivity, but if you have more than just very mild sensitivity, you may be better off getting a dentist to apply a varnish or a desensitizing gel which will last and stay on longer on the surface of a tooth. But you can use this in the background as well. The next toothpaste we're going to review is the Colgate Sensitive Pro Relief toothpaste. So this is a fight between the two big guns, i.e. Colgate and Sensodyne. Colgate realised that Sensodyne had been on the market for a long time, and they had nearly all of the market on sensitive type of toothpastes. So they thought, we're missing out on a lot of sales, so let's come out with our own toothpaste, but let's make it better, and we'll call it a toothpaste that relieves sensitivity instantly. As a dentist, I've never really seen it used on a patient where the sensitivity is instant. And another thing to bear in mind, it can be £8 for a tube, so it's the most expensive on show here, and unless you've tried the other sensitive type of toothpaste available and nothing works, then chances are probably this won't work either, but you can try it as a last resort. It has a nice fresh taste to it, and the taste doesn't linger on too much afterwards. One or two patients have reported ulcers when they use this type of toothpaste, so they don't use it anymore. The next one we're going to look at is the Phenol and Propolis toothpaste for sensitive teeth and gums. This is made by the green people, so it claims to have no artificial substances or chemicals inside it. It therefore does not contain any fluoride or any of these artificially designed chemicals to block out the nerve pain. In fact, when you look at the packet, I couldn't not find anything in there which specifically and scientifically has been proven to reduce sensitivity. It certainly isn't a harsh, abrasive type of toothpaste, so it would help those patients who have got sensitive teeth but they don't want to use a normal toothpaste which has lots of natural chemicals in it. In terms of the protection against sensitivity, it is nowhere near as effective as the mainstream brands, because it doesn't contain any of the chemicals that are proven to work against sensitive teeth. It's also reasonably priced for a green toothpaste at £4.50, because you have to remember the green products, they tend to cost more because they're probably made in far less quantities by smaller outfits. Let's look at next which is the Oral-B Pro Expert Professional Protection. Now this is marketed as the best toothpaste for all around protection. So now you don't have to use a tooth specifically for sensitive teeth. You can use a toothpaste such as this one, which claims to give protection against everything: gum disease, dental cavities. It will even whiten your teeth, and it will desensitize your teeth as well. It contains stannous fluoride and potassium nitrate as the desensitizing ingredients. So in reality it doesn't have anything extra that any of the other regular sensitive type of toothpastes have. It also doesn't contain any particular magic ingredient such as novomin or arginine. It's quite a fluid consistency, and an unusual thing that I did notice was when you if you leave the toothpaste with the lid off on an horizontal surface overnight, the contents of the toothpaste will actually leak out, which I don't think happens with any other toothpaste apart from this one. I particularly didn't like the taste, which is quite like sharp and tangy, and also you do notice the small beads inside it, which I also did not like, but that was quite a personal preference. Out of all the toothpastes, it's got quite the strongest taste, so it does linger on afterwards, and some people may not like this. At £3.50, the price is on the slightly lower end, which is still more expensive than just a normal regular toothpaste for general use. Now let's look at one of the supermarket's own brand of toothpaste. So Sainsbury's have come out with a toothpaste called Aura Care Plus Sensitive Toothpaste. For a 100ml tube, not a 75ml tube, for a 100ml tube, it's £1. So it's actually one of the, well, it actually is the cheapest toothpaste out of all of them here. It contains fluoride, as you would expect it to, and it contains a potassium salt in the form of potassium nitrate. So in reality, this is like a normal ordinary toothpaste with the extra desensitizing ingredient in for £1. Unless you absolutely love the other toothpastes or you absolutely hate this, this is probably the best value for a desensitizing toothpaste. And if your sensitivity is more than moderate or it's severe, then perhaps use this in the background while getting your dentist to apply a fluoride varnish or a gel or a glass enema over any exposed areas of dentine in your mouth. Finally, Sensodyne also came out with a toothpaste called Pro Enamel, and this is supposed to be for people who get sensitivity due to acid attacking their teeth. Now, this is £4 a tube, so it's still on the expensive end, but you, as a dentist, you will find that a patient doesn't have sensitive teeth through one particular thing. It's usually multifactorial. It might be a combination of acidic foods and drinks. It might be a combination of past gum disease, overbrushing, and so on. So, but this is really targeted at particularly those with sensitive teeth due to acid, and it contains again a potassium salt, potassium nitrate, fluoride, and it also contains extra calcium, which is supposed to precipitate back onto the surface of the tooth, hence mineralizing it. It's quite a fluid consistency, and you often have to it seems to dissolve in your mouth really quickly, so you often have to put another layer on your toothbrush. It's got a slightly bitter taste, and I'm not sure if everybody will be a fan of this one, but also I can't see who this would really be aimed at. So I've reviewed all of these 5 toothpastes out of a lot more there are on the market. I think in summary, if you tend to suffer from generalized sensitivity, I would recommend using any sensitive toothpaste, the cheapest on the market, as long as it contains a potassium salt and fluoride. You can go for a natural product, but it just doesn't have these special ingredients which are scientifically proven to reduce sensitivity. There are also more specialized toothpaste which claim to have these extra ingredients. However, if your teeth are that sensitive, then it's better to visit your dentist and have the sensitivity dealt with by a professional treatment. Thank you.